Good afternoon, friends. This is Natalia on the Doctor Online channel. In everyone's life, there are situations when a low-grade fever of 37 degrees and slightly above persists for a long time. How can you understand what caused this situation and what to do about it? That's what we'll talk about with you today. So, what exactly is subfebrile temperature? This is an increase in temperature over a long period of time, from 37.1 to 38 degrees. The temperature often stays elevated at 37.1 to 37.2 degrees for an extended period. What is hidden behind prolonged subfebrile temperature? First of all, any sluggish inflammatory process, which can be caused by a wide variety of diseases, may be hidden behind it. The culprits behind this condition can be herpes viruses and cytomegalovirus, which may remain in our bodies for a long time without showing any signs of their presence. How can you suspect the presence of this type of infection? Quite often, a characteristic rash appears on the skin and the salivary and other glands become enlarged. The unpleasant fact is that this infection can also affect internal organs such as the liver, kidneys, pancreas, and spleen. As practice shows, not every general practitioner recommends that their patients get tested for non-manifest viral infections, often forgetting about the existence of herpes virus and cytomegalovirus infections. Moreover, when positive results appear, they do not always receive the proper attention. If any of you have been coughing for a long time with scanty sputum and also suffer from night sweats, as some people say, you have to turn your pillow over to the dry side because it gets wet from sweat. Appetite decreases and an unexplained weakness takes over. First of all, you should consider the possibility of a tuberculosis infection. According to some data, a third of the world's population is currently infected with Koch's bacillus, and the number of cases continues to grow every year. Fortunately, at the current stage of medical development, tuberculosis is not a death sentence. Doctors have learned how to fight it effectively, although, unfortunately, it is not a problem that can be solved quickly. The prognosis of the disease depends on a whole range of factors, and first of all on the localization of the process, the stage of the disease, and the resistance of the tuberculosis mycobacteria to the treatment we provide. One of the causes of prolonged low-grade fever can also be viral hepatitis. At present, we know about the A, B, C, D, and E viruses of this disease. Moreover, this is far from a complete list of all viral hepatitis types. The most dangerous for the health of each of us are considered to be the hepatitis B and C viruses. It has been established that in every fifth person, the hepatitis C virus can cause liver cirrhosis and cancer. Unfortunately, the treatment of viral hepatitis is quite lengthy and expensive. Of course, we cannot rule out the fact that our immune system is capable of eliminating this disease on its own. However, this chance is quite small. Prolonged and persistent low-grade fever can also be observed in cancer, and this applies to cancer of any localization. Keeping this in mind, it is absolutely necessary to conduct cancer screening. In a number of cases, prolonged low-grade fever can also be caused by thyroid dysfunction. In particular, if the thyroid gland produces too many hormones, hyperthyroidism develops. How can you suspect this disease? Yes, it's very simple. First of all, appetite increases and there is a rapid heartbeat. A person becomes excessively fidgety, constantly needing to solve some problems and do something. In the end, the body's resources are quickly depleted. People suffering from this condition cannot tolerate stuffy rooms. At the same time, excessive sweating and a constant slight increase in body temperature become constant companions in life. The prescription of antithyroid medications helps stabilize the condition in these patients. It's hard to imagine, however, prolonged low-grade fever can also be a manifestation of a helminthic invasion. Its symptoms can easily be mistaken for signs of other diseases. The constant presence of a low-grade fever in this situation is the body's reaction to the waste products of the parasites. Often, prolonged low-grade fever in this situation is accompanied by nausea, vomiting, excessive gas accumulation in the intestines, and abdominal pain. Prolonged low-grade fever can also be caused by a number of rheumatological diseases and primarily by rheumatoid arthritis, systemic lupus erythematosus, various types of vasculitis, Crohn's disease, and a number of other conditions. In the modern era of the pandemic, many people, after having coronavirus disease 19, notice a slight increase in temperature for a long time, around 37.1 to 37.2 degrees Celsius. Moreover, this temperature tail can last for a long time, which depends on the state of the immune system and the thermoregulation system. In general, in some cases, a low-grade fever does not need to be reduced. At a temperature from 37 to 37.5 degrees, the enzyme systems of our body are activated, which serves as a trigger for the recovery of damaged tissues. And how can you help your body cope with a lingering fever? This is facilitated by proper rest. And first of all, 8 hours of sleep and a balanced diet with 5 meals a day, including 400 grams of vegetables and fruits in your daily intake, walks in the fresh air, and drinking at least 1.5 to 2 liters of clean drinking water per day. And also taking vitamin and mineral complexes that include vitamins B and C, magnesium, iron, selenium, zinc, and iodine. When talking about the problem of prolonged low-grade fever, we should also not forget about the rarer causes that can lead to its appearance. For example, cat scratch disease, Philinos, in which the nearby lymph nodes are affected. A skin rash appears, and the eyes, nervous system, and internal organs can also be involved. The cause of the disease is infection with an intracellular epocyla. In some cases, the disease has a mild clinical presentation, and apart from prolonged low-grade fever, no other symptoms of the disease are observed. But is it even necessary to address the issue of treating prolonged low-grade fever? Maybe just forget about everything and accept this condition? From my point of view, it's absolutely necessary to figure out the cause of a prolonged low-grade fever. Sooner or later, this leads to dysfunction of the pituitary gland and adrenal glands, and also affects a person's mental health and immunity. So how can you get rid of a prolonged low-grade fever? First of all, you need to identify its cause. To do this, you need to take the following tests: a complete blood count, a urinalysis, a stool test for eggs and worms, and a sputum test to check for the presence of mycobacteria and tuberculosis. You need to do a blood culture for sterility, get tested for the human immunodeficiency virus, viral hepatitis, and cytomegalovirus infection. You need to do a bacterial culture from the nasopharynx, get tested for tumor markers and thyroid hormones. In most cases, the tests I mentioned allow us to determine the cause of prolonged low-grade fever, and it seems to find the key to solving it. Are you sure you really need to bring down a high fever? Watch the video on my channel. Stay healthy, dear friends, and see you next time.